9 silent brain aneurysm warning signs most people miss. Most people believe a brain aneurysm gives no warning at all, that it simply strikes without notice, like a switch flipped in the dark. That belief is not entirely true. In many cases, the body sends out quiet signals well before a crisis ever unfolds. Signals that are often mistaken for stress, dehydration, or simply a bad day. This video is for general educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you ever suspect a medical emergency, please contact emergency services immediately. Over the next few minutes, we are going to walk through 9 signs that researchers and clinicians have associated with brain aneurysms. Some of them so easy to dismiss that even careful, health-conscious people overlook them. A few are the kind of thing you might notice in yourself. Others are easier to notice in someone you love, a parent, a spouse, a close friend, because you see them from the outside in a way they cannot see themselves. And there is one sign in particular, one we will get to a little later, that doctors describe as one of the most telling of all, precisely because it so rarely gets the attention it deserves. Keep that in mind as we go, because by the time we reach it, everything we cover before will make a lot more sense. Let's start with a bit of context, because understanding what an aneurysm actually is makes the rest of this conversation much easier to follow. A brain aneurysm is a weak or thin area in the wall of a blood vessel inside the brain that balloons outward, a little like a worn spot on a bicycle tire that bulges under pressure. Most aneurysms are small and never cause a problem at all. Many people live their entire lives with one and never know it existed. The concern arises when an aneurysm grows, presses on nearby structures, or in rarer cases, ruptures. That is why early awareness matters. It is not about fear. It is about paying attention to what your body might already be telling you. There are actually 2 very different situations we're talking about when we discuss aneurysm-related symptoms, and understanding the difference helps make sense of everything that follows. The first situation involves what is sometimes called an unruptured aneurysm that has grown large enough to press against nearby nerves or brain tissue. In this case, symptoms tend to build gradually, over days, weeks, or even months, as the pressure slowly increases. The second situation involves warning signs that can precede a more urgent event, sometimes appearing hours or even days beforehand as smaller amounts of blood begin to leak from a weakened vessel wall. A phenomenon some researchers refer to as a sentinel or warning presentation. Both situations produce overlapping symptoms, which is exactly why the signs we are about to walk through matter, regardless of which scenario applies. It also helps to understand roughly how common these situations are, simply to keep everything in perspective. Unruptured brain aneurysms are estimated to be present in a meaningful percentage of the general adult population, and the overwhelming majority never rupture or cause any symptoms whatsoever. This is not a video meant to make you fear every headache. It is meant to help you recognize the difference between an ordinary, forgettable headache and one that feels genuinely out of place, so you know when a conversation with a healthcare professional is worth having. Number 1, a sudden, unusually severe headache. Doctors sometimes call this a thunderclap headache, and the name fits. It is described as an intense headache that reaches its peak within seconds to a few minutes, unlike a typical headache that builds gradually over an hour or more. People who have experienced it often say it felt unlike any headache they had ever had before, sometimes describing it as the worst headache of their life. This does not mean every sudden headache is a medical emergency. Tension headaches and migraines can also appear quickly. However, a headache that is dramatically more severe than anything previously experienced, especially one that peaks almost instantly, may be associated with changes in blood vessels within the brain and is generally considered worth discussing with a healthcare professional without delay. Take Margaret, a 67-year-old retired schoolteacher from Ohio. She had dealt with migraines for decades and knew her own patterns well, the slow building pressure behind one eye, the familiar warning aura. One afternoon while gardening, she felt something entirely different, a sharp, overwhelming pain that seemed to explode at the back of her head within moments. She later said it did not feel like her usual migraines at all. It felt foreign, almost like a switch had been thrown. That distinction, the sense that something is different from your normal pattern, is often what clinicians pay closest attention to. What makes this particular sign so important is not simply the intensity of the pain, but the speed at which it arrives. A migraine, even a severe one, typically has a buildup, a warning phase that gives the person some sense that something is coming. A thunderclap headache offers no such warning. It has often been described as feeling like being struck, rather than gradually developing an ache. This is precisely why healthcare providers ask very specific questions when evaluating a headache complaint, not just how bad the pain is, but how quickly it reached its peak, and whether the person has ever felt anything like it before in their life. Number 2, pain or aching behind or above one eye. Localized pain concentrated behind or above a single eye, particularly when it appears without any history of eye strain or sinus trouble, may be associated with pressure on nearby nerves. Unlike a general headache that spreads across the head, this kind of pain tends to stay in one specific area, often intensifying gradually over hours or days rather than appearing all at once. Some people describe it as a deep ache, distinct from the surface irritation of a typical eye strain headache. Because our eyes and the nerves surrounding them sit close to several major blood vessels, changes in those vessels can sometimes produce this kind of localized discomfort even before more widely recognized symptoms appear. Consider Richard, a 63-year-old accountant from Illinois who noticed a persistent ache behind his left eye for nearly 2 weeks. He assumed it was related to long hours spent staring at spreadsheets and adjusted his glasses prescription, hoping that would resolve it. The pain did not fade. It was only when he mentioned it to his physician during an unrelated visit, almost as an afterthought, that further imaging was suggested. His experience is a useful reminder that persistent, one-sided pain that does not respond to the usual remedies, like rest, hydration, or updated glasses, is worth mentioning even if it seems minor. Number 3, drooping of one eyelid. This particular sign is one that a person might not notice in themselves right away, since it often shows up gradually and is far easier for someone else to spot in a photograph or during conversation. A drooping eyelid on one side, medically referred to as ptosis, pronounced ptosis, can occur when an aneurysm places pressure on a nerve responsible for eyelid movement. It is worth noting that many things can cause a drooping eyelid, including simple fatigue, allergies, or the natural effects of aging, so this alone is rarely a definitive indicator. Still, when it appears suddenly, particularly alongside other changes on the same side of the face, it may be worth mentioning to a healthcare provider. There is an added layer of significance when a drooping eyelid appears together with a dilated, or unusually widened, pupil on the same side. This particular combination is one that neurologists tend to view with extra attention, because it can suggest pressure on a specific nerve pathway responsible for both eyelid control and pupil size. Family members are often the ones who catch this first, noticing during a conversation or while looking through recent photographs that something about a loved one's face looks subtly different than it used to, even if the person themselves has not noticed anything at all. Number 4, blurred or double vision. Vision changes are among the more commonly reported early signs, and they can take several forms. Some people describe blurriness that comes and goes without an obvious cause. Others notice double vision, where a single object appears to split into 2 overlapping images, especially when looking to one side. These changes happen because certain aneurysms form near the nerves and blood vessels that control eye movement and visual processing. Consider James, a 58-year-old truck driver from Texas, who began noticing that highway signs seemed to blur and briefly double as he drove long stretches. He initially assumed it was simple eye strain from years behind the wheel and planned to get new glasses. It was only when the blurring became more frequent and was accompanied by a persistent ache behind one eye that he decided to bring it up during a routine appointment, a decision that led to further evaluation. Vision-related symptoms can also include a noticeable narrowing of the visual field, sometimes described as a kind of tunnel vision, or difficulty perceiving objects toward the edges of one's sight without turning the head. Because these changes tend to be gradual, they are among the easiest signs to rationalize away, particularly for people who already wear glasses or contact lenses and are accustomed to occasional visual fluctuations. The detail worth remembering is timing. Vision changes that appear suddenly, worsen over a short period, or affect only one eye rather than both, carry more diagnostic weight than gradual changes that develop over years, which are far more commonly related to normal aging or common eye conditions. Number 5. Sudden sensitivity to light. Photophobia, the medical term for unusual sensitivity to light, is something many of us associate with simple hangovers or ordinary migraines. However, a sudden and pronounced sensitivity that appears alongside a severe headache, neck discomfort, or vision changes may point to something beyond an everyday headache. In these cases, even moderate indoor lighting can feel uncomfortably bright, and sunlight may become nearly unbearable. When this symptom appears in isolation, it is rarely cause for alarm. When it shows up together with several of the other signs we are discussing, it becomes part of a broader pattern that a healthcare professional would want to evaluate. Interestingly, light sensitivity connected to vascular changes in the brain often arrives with a companion symptom, an aversion to sound as well, sometimes referred to as phonophobia. Someone experiencing this combination might find themselves retreating to a dark, quiet room, closing blinds that are normally left open, or asking family members to lower the television volume when nothing about the actual sound level has changed. On its own, this kind of behavior might simply reflect a rough day or a mild migraine. Paired with a headache that feels unusually severe, it becomes a detail worth mentioning to a doctor rather than waiting out. Before we continue, it is worth pausing to notice something. None of these signs, taken entirely on their own, are unusual or alarming. Headaches happen, eyes get tired, vision blurs after a long day. What matters is the pattern, the way certain signs cluster together, appear suddenly, or feel distinctly different from anything experienced before. That is exactly the idea behind the sign we mentioned earlier, the one many people overlook simply because it does not sound dramatic at all. Number 6. Numbness or weakness on one side of the face. When an aneurysm affects nerves that control facial sensation or movement, some people notice a subtle numbness or weakness limited to one side of the face, sometimes only around the mouth or cheek. This can be easy to dismiss, particularly because it may feel similar to how your face feels after a dose of numbing medication at the dentist. The key distinguishing detail clinicians look for is that it appears on only one side and arises without any clear cause, such as dental work or an injury. Facial asymmetry that develops suddenly, even something as small as one side of the mouth drooping slightly while smiling or speaking, is generally treated as a symptom worth having evaluated promptly, since it can also overlap with signs associated with stroke. This is one of the reasons many public health campaigns encourage people to periodically check for facial symmetry, particularly by asking someone to smile. An uneven smile, where one side lifts normally while the other lags slightly behind, can be an early clue that something in the nerve pathway on that side of the face is not functioning quite as it should. It is a small, simple check that takes only a few seconds, but can carry meaningful information, especially when paired with any of the other signs already discussed. Number 7. Neck stiffness or pain, especially with a headache. Stiffness in the neck that develops alongside a severe headache is a combination that healthcare providers take seriously, because it can suggest irritation extending from the head down into the surrounding tissue. This differs from the everyday stiff neck many of us experience after sleeping in an awkward position or spending a day hunched over a desk. The stiffness associated with aneurysm-related symptoms tends to appear together with head pain rather than as an isolated muscular issue, and it may make it uncomfortable or difficult to tuck the chin toward the chest. Consider Dorothy, a 72-year-old grandmother from Georgia, who mentioned to her daughter that her neck felt unusually tight the same afternoon she developed a headache, unlike her usual tension headaches. Individually, either symptom might have been dismissed. Together, they prompted her daughter to encourage her to seek medical attention that same day. The reason neck stiffness draws attention in this context relates to the tissue and fluid that surrounds the brain and spinal cord. When irritation occurs near this area, whether from pressure, inflammation, or small amounts of blood, it can create a sensation of tightness that extends down into the neck and sometimes even the upper shoulders. This differs meaningfully from muscular neck pain caused by poor posture or sleeping position, which usually responds to gentle stretching, heat, or over-the-counter pain relief within a day or two. Stiffness connected to changes in the brain tends to persist despite these usual remedies, and is far more likely to appear alongside a headache rather than as a standalone complaint. Number 8. Nausea or vomiting without an obvious cause. Nausea and vomiting are common symptoms with countless possible explanations, from something as simple as food that did not agree with someone to a passing stomach bug. What draws attention from a clinical perspective is nausea or vomiting that appears suddenly alongside a severe headache, particularly one that feels different from any headache experienced in the past. This combination may be associated with increased pressure within the skull, which can accompany changes in blood vessels in the brain. As with several of the signs we have discussed, context matters far more than the symptom in isolation. Take the case of Harold, a 69-year-old retired postal worker from Pennsylvania, who woke up one morning feeling nauseated and assumed he had simply eaten something that disagreed with him the night before. By midday, the nausea had not improved, and a dull headache had settled in behind his eyes, something he brushed off as a side effect of not eating much that day. It was his wife who noticed the combination did not quite add up, pointing out that he rarely got headaches and had not eaten anything unusual. That observation was enough to convince him to call his doctor's office rather than simply wait it out, illustrating how a second set of eyes, someone who knows your normal patterns, can sometimes notice what we overlook in ourselves. Number 9. Sudden confusion, difficulty speaking, or loss of balance. This is the sign we mentioned earlier, the one that tends to receive far less attention than a severe headache, yet is considered by many neurologists to be among the most significant. Sudden confusion, trouble finding the right words, slurred speech, or a sudden loss of coordination and balance can indicate that a blood vessel change is affecting brain function in a broader way, beyond localized pain. These symptoms are frequently associated with stroke as well, and the overlap is not a coincidence. Both conditions involve changes in blood flow to the brain, and both require urgent evaluation. Family members often describe this sign as the most frightening precisely because it can appear so suddenly. A person mid-sentence who suddenly cannot finish their thought, or someone who stands up and unexpectedly loses their balance for no apparent reason. If you ever witness these symptoms in yourself or someone else, especially in combination with a severe headache, seeking emergency medical care immediately is strongly advised, since rapid evaluation can make a meaningful difference in outcomes. Consider the story of Walter, a 74-year-old retired mechanic from Michigan, who was having a normal conversation with his son over the phone when he suddenly began repeating himself and struggling to find simple words he used every single day. His son, sensing something was deeply wrong even though his father insisted he felt fine, called emergency services right away rather than waiting to see if the confusion would pass on its own. Stories like this highlight an important truth: sudden neurological changes are sometimes more obvious to the people around us than to ourselves, since confusion can affect a person's own awareness that anything unusual is happening at all. This is exactly why loved ones are often encouraged to trust their instincts and act quickly rather than waiting for the person experiencing the symptoms to recognize the severity themselves. It is worth remembering that having one of these signs, especially in isolation, does not mean a person has a brain aneurysm. Many of these symptoms overlap with far more common and far less serious conditions, from tension headaches to sinus infections to simple fatigue. What tends to matter most, according to available research, is the combination of symptoms, how suddenly they appear, and whether they represent a clear departure from what a person normally experiences. Paying attention to those patterns, rather than panicking over any single symptom, is the approach most healthcare professionals recommend. It is also worth mentioning that certain factors are associated with a higher likelihood of developing a brain aneurysm, including a family history of aneurysms, high blood pressure that goes unmanaged over time, smoking, and certain inherited connective tissue conditions. None of these factors guarantee that an aneurysm will develop, and their absence does not guarantee that one will not. They simply help explain why some people and their healthcare providers may choose to monitor blood vessel health more closely than others, particularly when there is a known family history. Age and biological sex also appear to play a role, based on available research. Aneurysms tend to become more commonly diagnosed as people move into their 50s, 60s, and beyond. And some studies suggest they are diagnosed somewhat more frequently in women than in men, though researchers continue to study the reasons behind this difference. None of this information is meant to suggest that younger people or men can dismiss these symptoms. Aneurysms have been documented across a wide range of ages, and the warning signs we have covered apply regardless of demographic background. The factors are simply useful context for understanding why a healthcare provider might ask about family history or lifestyle habits during an evaluation, rather than treating every headache as identical in risk. It is also reasonable to ask what a medical evaluation actually looks like if a healthcare provider suspects something may be worth investigating further. In most cases, this begins with a conversation about symptoms, their timing, and their severity, followed potentially by imaging such as a computed tomography scan, often referred to simply as a CAT scan or a magnetic resonance imaging scan, commonly known as an MRI. These imaging techniques allow specialists to look directly at the blood vessels within the brain and identify whether an aneurysm or other vascular change is present. None of this is meant to be frightening. It is simply useful to know what the process generally involves, so that if a healthcare provider recommends imaging, it does not come as a confusing or unexpected step. So what should you actually do with this information? The most useful takeaway is not to memorize 9 symptoms and worry over every headache or moment of dizziness. It is to build a general awareness of your own normal, so that when something departs sharply from that normal, whether it is a headache unlike any other, a sudden change in vision, or an unexpected moment of confusion, you take it seriously enough to have it checked. Early evaluation does not guarantee a particular outcome, but it does give healthcare professionals the best possible opportunity to assess what is happening and determine the appropriate next steps. To bring everything together, one detail is worth repeating, because it captures why paying attention early matters so much. Among the 9 signs we covered, the combination of a severe, sudden headache together with neurological changes, such as confusion, difficulty speaking, or loss of balance, is the pattern most consistently linked to the more urgent presentations that require immediate medical attention. That single distinction, a headache that stands apart from anything felt before, paired with any sign that something in the brain's function itself has shifted, is the pattern worth remembering above all the rest. Awareness like this is not about living in fear of your own body. It is about respecting the signals your body sends and giving yourself, or someone you love, the best possible chance at an early conversation with a healthcare professional. None of the 9 signs we covered today, the sudden severe headache, the pain behind one eye, the drooping eyelid, blurred or double vision, sensitivity to light, facial numbness, neck stiffness, unexplained nausea, or sudden confusion and loss of balance, should be treated as a diagnosis on their own. What they represent, together, is a pattern worth understanding, so that if your body ever does send one of these signals, you recognize it for what it might be rather than dismissing it as just another rough day. If someone in your life has experienced any of these signs, or if this video helped you understand something about your own health a little more clearly, we would genuinely love to hear about it in the comments below. What sign surprised you the most? Was there one you had personally experienced without ever realizing it might be worth mentioning to a doctor? If you found this information valuable, consider sharing it with someone who might need to hear it, a parent, a sibling, or a friend who tends to brush off symptoms the way so many of us do. And if you would like to see more educational content like this, subscribing helps us continue creating it, one honest, carefully researched video at a time.